Welcome back to another video. In today's video, I'm going to talk about how I make my brain sheet for my nursing shift. If you want to gain more nursing knowledge and to improve your nursing skills, you want to make sure you subscribe right now because I'm going to be uploading a video every single week and you don't want to miss out on them. Alright, so let's get right into it. How do I make my brain sheet? So as many of you know, I work on a medical unit and a lot of times it gets very busy. Sometimes I have 5 patients and on the odd rare occasion I do have 6 patients. So what do I look out for and how do I make my brain sheet? So the first thing that I do is I make sure I write down all my patients' names and room numbers. Then I take a look at their code status. That's very important because if anything were to go wrong, you want to know what you should do if, for example, you saw the patient and they were unconscious, and you want to know that what are their code statuses so that you can press either the full code button or you're going to provide effective immediate interventions depending on the patient's wishes. The next thing that I want to do is I want to make sure that I understand why the patient's here. So I quickly look up in their chart. What is their admitting diagnosis? Why is that patient still here? And what are they working on with that patient? The best way you do that is to look up the patient's notes that the doctor wrote. A lot of times the doctor will list off why that patient's here and what they're working on right now and what has been resolved. The next thing I do is to look at the patient's past medical history. Do they have any masses in their lungs? Is there anything that you may need to know that may be on their medication list so that when you go and give the medications to that patient, you're like, oh, that's why this patient is taking a cancer medication. That's why the patient's on a beta blocker and whatnot. The next thing I do is make sure that I identify how long has that patient been at the hospital for. It's important to identify this because you want to know how acute that patient is. If they've been recently moved from emerge onto our unit, then I know that, okay, this patient may be more acute than my patient who's been here for 30 days and they're just working on their mobility. Next question I have for a person that's giving me a report for my patient load is to know the patient's orientation. You want to know if they're confused. If you speak to them, will that patient know what you're saying? Is that patient understanding of their situation? Is that patient able to identify what's a risky behavior? For example, if you have an elderly patient and they're very confused, are they a falls risk, for instance? And that's something you always want to consider because a lot of the elderly patients, of course, are frail, and if they have a fall, it could be quite detrimental. Next, you want to know what is their continence. Does the patient unfortunately wet themselves? Does the patient know when they have to go to the bathroom? Do they need to be frequently changed or frequently reminded to use the bathroom? These are things that you want to know going on to the shift so that you're able to do a good assessment and to work kind of ahead. You always want to know that if that patient, has a soiled brief, you want to provide a brief change while you do your set of vitals so that you're multitasking, you're clustering your care. The next thing I look at is to look at their labs. So depending on the patient's condition and why they're obviously here, you want to make sure you take note of certain lab values. For example, if someone has a lower GI bleed, or that patient has had has been, for example, coughing red blood tinged sputum, has that patient been having tarry black stools, has that patient been peeing bloody urine? So for those reasons, you want to look at like the hemoglobin value. What is their hemoglobin value, and do they need to be transfused? Do I expect them to be transfused? What do I want to mention to the doctor when I see them for a brief moment throughout the day? Next thing I want to look at is what diagnostic testing is that patient going for. It's important for you to identify the diagnostic testing so that you're able to prepare the patient for that diagnostic test. Does the patient need certain medications? For example, working on a cardiac unit, sometimes the patients go for what's called a CT angio, and they require the patient to be on a certain heart rate in order for them to go for that test. In addition, you also want to be prepared. So when the stretcher comes to take the patient, you want to know how long will it take for you to move that patient from the bed to that stretcher so that they can go for that diagnostic testing. All these things you want to consider during your shift, and that's what I look out for during my brain sheet. I don't make one of those complex brain sheets where I write down the sodium or like the potassium, the hemoglobin, the creatinine, the GFR level for each and every patient. I think just like we provide care for each patient, each brain sheet that we make for each patient should be individual for that patient's condition and situation that they're in at the hospital. Anyways, guys, this video is getting quite long. If you like this video, please give it a thumbs up. Please consider subscribing down below if you thought this video was helpful. And let me know if you do anything different on your brain sheets that I may have missed out. Thank you guys, and see you in the next video.